I'm so grateful to be interviewing Dr. Teplinsky today. She is my newest medical advisor with Learn Look Locate. She is a medical oncologist. And I just want to ask you a little bit about yourself for those people that don't know you and why you decided to join the Learn Look Locate team of incredible physicians, now up to 20. Well, we're so excited to have you.
Thank you for having me. I'm Dr. Eleonora Teplinsky. I'm a board certified medical oncologist. I specialize in the treatment of breast and gynecologic cancer. So I practice in New Jersey at Valley Health System. And I've been, educating on social media for years, because there is a need and people, there's a lot of misinformation on social media. And so there's a need for evidence-based and accurate information. And I think that kind of aligns with your mission at Learn, Look, Locate to educate and to expand people's knowledge. So it really seemed like a great fit.
No, we're so happy to have you. Thank you so much, Dr. Teplinsky. I want to ask you some of the questions that resonate with me as a 6-year survivor. So, my whole identity was broken, and I know that this is a big passion point of yours. When are we truly a survivor? And can you explain exactly we survived? Did we survive a cancer diagnosis? Did we survive treatment? How would you define that?
I think the key is not to label anyone, and people really can define themselves the way that they want to. With that said, the American Cancer Society and other organizations really define survivorship from the date of diagnosis, because from that point you're surviving and living with breast cancer. Some people that word doesn't resonate with them. Some people it only resonates after a certain cancer milestone. So it really is a little bit of an individual term for people. But with that said, it is defined in the medical world as from the date of diagnosis.
So, how do we handle survivorship guilt? That is something I wanted to ask you about because sometimes it's really hard when you're older and you're dealing with seeing on social media a lot of young people getting diagnosed. Any thoughts on that?
I think similarly, that's a very, some people experience survivor's guilt, some people don't, especially when they see other people. And this isn't limited to social media. I think a really important part is that a lot of breast cancer treatment really happens obviously not on social media. So a lot of people have that guilt when they see people that they were treated with who now experience a recurrence or who have passed away from the disease. And, there's a lot of feelings that go into that. And I think, kind of recognizing that those feelings are normal and having a toolkit, whether that be talking to a therapist or going to a support group, like knowing that those feelings are normal and having some ways to cope with them.
That's been really, really helpful. How do we handle survivorship if we get a reoccurrence? I mean, are we still a survivor? What does that mean?
So I think we want to come back to my original point, right? Which is that survivorship is defined from the day of diagnosis. And so as long as you're living with the disease, whether it's active or not, you are again considered a survivor. Now that term, as I've mentioned, maybe doesn't resonate with some people. Some people like to say they're a thriver. Some people don't use any words to define them. And I think the key is that it really is an individual term. Some people just prefer to describe what they've been through. I don't like to label anyone, and so it's whatever term you're most comfortable with.
How would you suggest survivors educate themselves on the lifestyle and how to live their lives without scaring themselves? Any suggestions?
And I think that's a whole topic on its own.
Yeah.
But there are a number of societies and guidelines. I would start by talking to your doctor. This is somebody in your healthcare team, right? This is your team that you trust and help you. But the American Cancer Society has a lot of great resources that people can use. I would ask at your cancer center, are there resources? Is there a dietitian? Is there a gym? Are there community classes? Things like that. They organizations like Living Beyond Breast Cancer have a lot of really good resources, like American Cancer Society. So there's many out there. I think it's just figuring out what resources are great for you. And I think a lot of it also is knowing, what the recommendations are, and that includes exercise, limiting alcohol use, not being sedentary, avoiding ultra processed and refined foods. And we find that unfortunately a lot of survivors are not aware of that. And that comes because most of them aren't being told about it. There was a
Mhm.
study that came out that said a very small amount of people were actually adhering to the guidelines. And the feedback was, well, we didn't even know what the guide, as patients say we didn't know what the guidelines were. So I think a lot of it, and the challenge is people are not necessarily getting it from their, doctor's offices. And I think it's important to have that conversation.
That's really helpful. So here's a good timely one. How are survivors supposed to handle October? Even myself, as the days are getting closer, I'm getting anxious. Any thoughts around that?
And I think a lot of these questions are kind of saying, what should survivors do, right? And there's not an answer for that because everyone is different. And I think clumping people in and telling them how they should do what they should do really probably is not very fruitful for many. Everyone's going to handle it in different ways. Some people really use that month to advocate and talk about their diagnosis and, really lead the way in having these conversations. And for some people, that's very fulfilling. Other people don't want to do that, and that's totally okay as well. There's really, again, I mean, I think the big thing with survivorship, it's not a one size fits all. And I think the more we try to kind of do that, the more we're going to alienate people. So I think realizing what you need in that month, that may be staying off social media, that may be educating others, that may be going to a walk or an event, and it may not be, right? Figuring
Yeah.
out and your feelings of October, people's feelings change, I think, based on are they a year out, are they newly diagnosed, 10
Mhm.
years out? So I think everyone's got to handle it in their own way.
So this is a big passion point for you, as you've shared with me. Can you share, why working, with patients on survivorship and, just kind of your overall thoughts around it? So as opposed to, some of my questions here, kind of
Can you elaborate on that a little bit?
just, the importance of the attention towards survivorship. I know that's something that's really important to you, and I agree. I think there's not a lot of discussion around this because I think we feel lost after the diagnosis,
I mean,
even years after. So this seems to be resonate with you, and as far as your topic here at Learn Look Locate. So I'd like to learn more about that.
survivorship is really just as important as active treatment. There's so much attention often paid to the active treatment part, chemo and radiation and surgery and kind of that initial stuff. But then people are really left often feeling
Yes.
not done with my treatment. I have all these side effects, and how do I manage that? And they often feel a little bit lost, or they don't feel like they have the same support that they did. And really, I mean, I think that the survivorship period can be harder than that active period. And so I think that's it's an important part of cancer treatment that we don't want to, let people kind of slip through the cracks and not get the support and care that they need.
It's really nice that you bring that up because I definitely feel like that's happened to me, and I still feel that way despite it all. And I know there's many people that are even 6, 7 years out, or whether it be 2 years out, that we feel like survivorship is really not talked about, and there's not an emotional sense around that. Um, I still think the shock of knowing that we had cancer is part of processing. Even the brain, I don't think can catch up with the fact, like, how did this happen? Or why? I have no family history. So the questioning of it all is something that I know I struggle with. I ate well, I exercise, like why did this happen? So I think and also seeing this happen to a lot more younger people. So addressing that, if you don't mind, the survivorship for young people as they're just starting their careers or thinking of a family. That's such an important topic, on how they cope with that.
Again, I think, there's really not a one size fits all approach, right? There just isn't.
Yeah.
And it looks different for different people. I think it can be very challenging for people who are in the throes of, dating and relationships and jobs and financial security and parenting and children. And, just like it's challenging for people at also maybe a later point in their life at retirement. I mean, I think it's hard at any point. There's just different needs at different stages. Uh,
Mhm.
Everyone's in a different season of life when they get diagnosed, right? So whatever season you're in, I think is going to come with its own challenges. There's just not a one way to handle that.
Yeah,
You can have two people, same diagnosis, both navigating the same things in their life, and everyone's going to have different side effects and
yeah.
symptoms, reactions and responses. So I think that the big thing is figuring out, how do we support survivors on really a broader level, with that's with education and policy change, and making sure that they're all of these kind of delayed or long-term things that may be impacted as a result of their cancer diagnosis and treatment, that they have that support and education on in the future.
Yeah, support and education, those are two great key words for this. And I ask you because you're a medical oncologist, the oncologists really stay with you throughout the journey, more so than the breast surgeon or the radiation oncologist per se. So you really do play that critical role. I think it's important for newly diagnosed to understand that. Can you tell us a little bit more about that role within a breast cancer patient and how a medical oncologist is a little bit more by your side?
Absolutely. I mean, I think as you said, they're with you for, and again, that varies also depending. Some patients do get kind of transitioned more to a survivorship program at a certain point. So that really depends on your cancer center and the
Mhm.
resources, things like that. But the medical oncologist, the person that really navigates all of the systemic therapy, right? So that's therapy that goes through the whole body to reduce the risk of the cancer coming back. And so that includes chemotherapy and endocrine therapy and immunotherapy and anti-HER2 therapy and targeted therapy and so forth. And so as a result, you're seeing that person often because you're following up and you're managing side effects, you're assessing for recurrence, checking in every so often. So yeah, most often you're going to see that person probably the longest out of anyone on your care team. And I think the other point to make is that, the oncologist is just the oncologist is just one point on your care team, right? That
Mhm.
sometimes people feel like, okay, when my visit was quick and I'm still missing, I didn't
Mm,
questions about this and I have questions about that.
yes.
I think that's where it's really, you think about the team with the patient at its center and then all these other people, right? So your team is not just the doctors, it's all the support staff, it's your nurses, your advanced practice providers, your social workers, your dietitians, your counselors, your nurses, your supervision nurses. It's all of these people, um, therapists, physical therapists, occupational therapists. I mean, the list is super long and I'm sure I'm missing a ton of people in that. But those are all the people that are going to help you live your healthiest life, both during and after cancer.
So, Dr. Teplinsky, what if you don't have a medical oncologist that doesn't have a compassionate, humanistic touch and really just kind of says, you need to take tamoxifen and I gotta go? That's kind of where I was. And so it's been an honor to meet people like you and Dr. Singh who really have a compassionate way of approaching this. So what do we do? Because that's what happened to me,
I think that's hard. And again, an individual
right?
decision. Some people don't have, it's easy for me to say, oh, just go see someone else, but that's not
Right.
always possible for many people.
Yeah.
There may not be anyone there to see, their insurance may not allow it. There's a lot of reasons why people can't switch oncologists, and that's why I think it can be helpful. If you do want to switch, certainly, and that's an option, that could be something to consider. But then also I think thinking about all of the other resources that are available to you, right? So who else is at your center?
Mhm.
Or social workers that you connect with, or nurse practitioners, or whoever, right? Maybe you go outside of your center to find these people. There's a lot of organizations and online that can help you find your own community as well.
Yeah.
Um, and so that's something that you can, there's support groups. So that could be some way you can, find those other resources. But it is hard and it's challenging, but unfortunately it's not always feasible for people to switch
Yeah.
doctors.
Yeah. I think that's why the work that you do and really share the information, and your sense of compassion is really welcoming so that people see that, yeah, there is that support out there. You might not be their doctor per se, but you're providing the information and the emotional support from some of the things that you say that make us feel, more educated and supported. So I think survivorship is, kind of complex. Many people quit their jobs, change their life. That's what I did. Move, I mean, it can change us in ways that are really quite positive. So for me, that I want to share that it has been more for the positive in a lot of ways. I mean, you really do redefine your whole everything. So I don't know if you have patients that or people that you work with that.
Make the point, and I think what you're doing and what you're doing with Learn, Look, Locate is really incredible, and it's a needed resource for so many. But on the flip side, I do want to make the point that, I think someone I had on my podcast years ago kind of coined the term super survivor. He said, you don't have to be a super survivor, meaning, you don't have to do all of these things. I think sometimes people feel that, oh my gosh, I'm on social media, right? There's a lot of imposter syndrome, and this person's doing this, and they're a survivor, and look, they started this organization, they're doing this, and I don't want to do that, as this, and so that's okay, right? So I always say to the patients, you don't have to, you don't have to take this diagnosis and reinvent yourself. But it's okay. It's great if you do, and it's great if you don't. So I also just never want people to feel like they have to do something different, right? Because
Yeah.
I think that you don't.
Oh, you're going to make me want to cry. I could not sit still. There are many of us that get bitten by this in a way that's very strong, and we want to make a difference. And I like the word super survivor because there are days when it's hard, because, just one person trying to push it up, change it, and make it global. And I agree. I think it's a really good point. I think a lot of us feel compelled to do something, and that can be exhausting too, because sometimes we just want to move on with our lives, right? I mean, my mother had a very, very orphan disease called ALS, and after she died, I did not want to do anything with that. I just wanted to, so that reminds me of what you're saying. So I do appreciate that. Any last closing thoughts? Because this is really, this is an important part of my work here, and I'm so glad you wanted to do this, because I didn't have this part of this. I don't want to say journey, but part of what we experience. So I would love your personal thoughts behind all of this.
I think it is. I mean, it is such a key part, and it's the part that doesn't end, right? Chemotherapy ends, and radiation ends, and this part
Yes.
and figuring out how do I live in my new body that's been changed, that's been
Yes.
altered, right? Mental health impacts, right? Bone health, cardiovascular, I mean, all
Yes.
sexual, all of these things that, get impacted as a result of a diagnosis. And some people, come through a little bit more unscathed than others. It affects
Mm,
everyone in different ways.
mm,
And I think the key is just knowing that for people listening to this or watching this, that, you're not alone, that there are so many others
mm,
going through similar things. And there are really amazing communities out there that people can find
mm.
to help them, connect with others going through similar things. And there's a lot of resources, a lot of discussion now being made to survivorship, which I think is important as well, a lot of research. And that's something,
Mm.
is important and new and needed.